Good evening, members. It's now 7 o'clock. Right, I'd like to welcome everybody to the January meeting. I can take this off to speak, can't I? I'd like to welcome everybody to a January meeting of the Health Overview and Scrutiny Committee of Woking Borough Council. My name's Alison Swaddle. I'm the chairman of this committee. And with me this evening, I have, looking around the chamber, councillors Adrian Mather, Carl Duran, Tahir Mayer, Sam Akhtar, Michael Firmager, Barry Patman and Jackie Rance, and Councillor Rachel Bishop-Firth is joining us on Teams. So there can't be any apologies there. Members, if you could turn your attention to the minutes of the previous meeting on pages 5 to 14. Does anyone have any comments, amendments they would like making? Thank you. In which case, would you raise your hands to confirm approval of the minutes? Thank you very much. Do any of you need to make a declaration of interest this evening? Okay. Madeline, do we have any public questions? No. Right, thank you. Do we have any member questions? Right. As members will have noticed, the agenda this evening is far lighter than we all anticipated when we looked at planning our programme. This is because officers within adult social care are very, very busy at the moment dealing with COVID prevention, the booster programme, etc. So we agreed that items that they would have been presenting, we will defer to a later meeting. And I think we did email around, Madeline, didn't we? And everybody agreed that that was the way forward. Other items have also had to be moved back. When we come to look at the forward programme, I think we have got a difficulty of fitting everything into this year. We might need to discuss an extra meeting. However, we do have item 45, to receive an update on public toilet provision in the borough and to receive information from the Crohn's and Colitis UK. At this point, I should declare that I am a member of Crohn's and Colitis UK, although I don't think that's a declaration of interest. With us this evening, we have Mark Redfern, I believe. Are you there, Mark? Hello, would you like to take us through all of the information that you've gathered? And would it be all right if members sort of gave you questions as and when they arose?
I could probably take you through the report first and then we'll do questions after that, if that's okay, Chair.
No, that's absolutely fine. Thank you.
Thank you. Good evening, everyone. Apologies, it's always a slightly sort of weird sort of format to have a meeting and receive a presentation. The report that was pulled together that's in front of you this evening was actually ready last year, and apologies for not being able to come along to the committee in September and to present the information in this report. Public toilet provision is an interesting one for the council. You'll see in the report it mentions a couple of times that the local authority doesn't have any statutory responsibilities in terms of providing public toilets for residents, although many local authorities obviously do. And our approach to making public toilets available to our residents changed significantly in 2009, when we moved away from the traditional model of having toilet facilities that people would go in and use, to the establishment of what was called the local loo scheme. In fact, it still is. The local loo scheme works by local businesses primarily across the borough, allowing access to toilet facilities by the general public, and they show this by displaying a small sticker or sign in their windows to tell residents that they can go in and use the toilet facilities there. At the present time, I think we have 10 local loos established across the borough. It's my understanding, I wasn't heavily involved in this at the time, that the primary reason for moving to this was to improve the choice and quality of toilet facilities available. The borough's toilet facilities at the time, I understand, were often prone to vandalism and cost a lot to maintain and upkeep to a standard that would have been acceptable. So at the time, this was seen as a way of providing better toilet facilities for our residents. As part of this review into public toilets, we also took a relatively quick sort of desktop audit of what toilet facilities are available across the borough, generally for residents to use. And you'll see in the report that there's around about just over 170 toilets that people could have access to in a range of facilities. Some are in some of our public council buildings, some are in retail sectors, others are in sort of entertainment sectors in terms of, like, bars and clubs and those sorts of things. There are lots of toilets available in things like garages and petrol stations. And there's also a map at the end of the report to show where these are sort of located all across the borough. And it's fair to say that there's a reasonable spread in terms of the main sort of urban areas that exist. We also wanted to take a quick look at what the public were demanding in terms of toilet facilities or their sort of satisfaction in terms of contact with the council. And so I worked with our local, customer services team to understand what levels of complaints or inquiries there have been around public toilets. And as you'll see, it's a really low number. In fact, I think there was only one inquiry recently that we've had about toilet facilities. That doesn't mean to say necessarily that residents don't want them or don't have some thoughts about them, but that's the case in terms of what was made to our customer services. The last bit of information I've put in there, I think it might be particularly relevant again for the Health Overview and Scrutiny Committee, is the access to changing places, toilet facilities. And these are toilet facilities that are significantly enhanced to meet people with additional needs. Presently, there aren't that many across the borough or even the extended sort of area. And it's something that I know certainly when we're doing things like new community facilities and those sorts of things, we're trying wherever possible to increase the number of those facilities that are available. For example, the new community centre that we're providing as part of the North Wokingham SDL at Matthews Green, that has a changing places toilet that will be available to the public when that opens. So I think, in summary, this is an interesting one for the local authority. It's something that we obviously want to do because we do make public toilets available in 10 locations across the borough, and we provide access to toilets in council facilities. But presently there aren't any statutory obligations on the local authority to do this. So that's kind of the overview of the state of play with public toilets. I'll preface question time with, there's definitely no one in the council responsible for public toilets because we don't provide them. What we do is administer the local loo scheme, and as such we have contact with local businesses around that. But it was actually quite interesting to find someone to present this report and pull it together. But being the head of localities responsible for a range of sort of community-based activities, it felt that I was a good fit for this. But there may be some questions that come up that I might not know the answers to, but I will try my best. Thank you, Chair.
Thank you, Mark. So I don't want to preempt this, but I'm looking at the recommendation that we have is about reviewing signage and publicity. So is that something you considered within the report, whether you feel that the signage is sufficient? I know if you ask a resident, where would you go to a toilet, and sometimes they're surprised because they haven't realised that there are toilets that they can use because there isn't sufficient signposting. I'm thinking of perhaps of Peach Place. That was a new, what I would thought was a public toilet, but perhaps it isn't since it's not listed.
I think it might be something that's provided by the town council.
Right, I see. But for example, a sign from Rose Street to that, so that people are aware it's there. So where we've got a recommendation to review signage and publicity, could you just tell me a little bit more about what that would involve?
I think I put it in there as an indicator of what I thought one of the things that we could do to try and improve our services to our residents, and clearly because of that is something that you've picked up, Chair. I think what we would think about doing is understanding, when people sort of enter the different sort of urban areas or conurbations that we have across the borough. Are there clear sort of signs? Are people made aware that in that vicinity there's going to be places where they can access toilet facilities? If that was something that was felt that we could do, and then think about what those signs could be, that could form part of the work that there's a number of sort of town centre sort of management sort of committees or initiatives that exist in Woking, Woodley, Twyford, Early, that sort of thing. So they could be involved potentially in that. It might want to be expanded, so it wasn't just in terms of local authority facilities, it was other toilet facilities that people can access. But I think always what we would strive to do is make sure that residents are able to access the facilities of any type that are important to them, and communication and signposting is just a really important part of that.
That's right, because if you look on page 26 in the recommendations from the Crohn's and Colitis, they're saying that local authorities should take the lead role in facilitating and publishing information, which seems to tie in with what you were saying we should have an ambition to do. I don't know if this comes in within your remit, but another sort of recommendation within their written input to the meeting was about not every disability is visible signs on toilets, and that perhaps we should ensure that we have those on all of the toilet facilities that we make available, not just to the public, but also to our staff. It's
something we could certainly pick up with our facilities service. They'll be the ones who are responsible for obviously the management of things that toilet facilities that we do provide in our buildings. And it's probably something that's interesting. I mean, certainly we've had, I think the public become a lot more aware during COVID that people can have conditions that aren't obvious. That means that they are behaving in a way that might perceive to be different to what is the regulations. I'm talking obviously about face masks in this sort of instance. So it might be timely to talk about, there are people, there are disabilities that people could, have and be living with, which aren't particularly visible, but which might affect how they behaved in certain situations. But it's certainly something I could sort of pass on to our facilities team, definitely.
Yeah, I think it's something that should become standard, that a disabled toilet has that sign reminding people that not all disabilities are visible, because I've known people, come out from changing their stoma bag where clearly they need a disabled cubicle to face abuse from somebody because they weren't in a wheelchair. I think it's quite a simple thing, but so important. And we saw that in some of the evidence from Woking residents on page 33. Sorry, members. Sam, and then I can see Carl.
Thank you, Chairman. Question I've got, Mark, is one thing which I've always found in sort of in and around my ward, things like petrol stations. I mean, I tend to find that there's a lot of I get a lot of drivers sort of passing through long journeys through my ward and the neighbouring wards, and often they're sort of struggling to say, okay, where obviously they need to go to the loo, and we've all seen sort of people parked up by sides of motorways, often urinating, which is really unpleasant. Is there anything that can be done, particularly to sort of work closely with petrol stations? So I know there's a number of them that have toilets, but often, like as Alison remarked earlier, that actually there's a number, it's not very obvious. Like there's a few even near me, I can say Shepherd's Hill, VP, for example, potentially Texcoach Harville, VP and Twyford, where they have got toilets, but often you can easily miss it. So is there something that we could maybe do to work with them? Re-signage. And my other question was just the scheme in general. Is there a particular limit towards how many of these businesses can sign up to the local loo scheme? So I think it's a great initiative, but is there like a cap, for example? Could, in theory, every cafe or restaurant sign up to it in the borough?
I'll take your second part first, because it's probably the easiest one to talk about. At the moment, there's not a cap. So we've got 10 schemes. We pay them about £600 a year each, with one that we pay £1,000 a year to. So it's not huge amounts of money. Obviously, the more that we sign up, the greater the budget increase we need for sort of that scheme, but not presently a cap, no. And if anyone has ideas for people that the council can approach around the local loo scheme, it would be good to hear about them. I think in terms of the second point, it's possibly something we could take forward through some of our links with, business groups and the sort of economic development team in the council around encouraging businesses to sort of, highlight and sort of communicate clearly what facilities they do have available. That's probably, as I would see it, the best way to start that conversation with petrol station providers across the borough.
Thank you, Mark.
Thank you.
Cole?
Thanks, Alison. Yeah, I was going to ask a question. You mentioned just then that the local loo providers get 600 quid, apart from one who gets 1,000. Just be interested to know if you can tell us who that is and why, if you can, maybe a commercial thing. And the other thing just I want to mention, and you'll know this, Alison, but talking about signage, I think that's a very good point you made, because in Woodley, the signage points to the toilets that have historically been there or the local loo scheme, and are all pointing away from the actual public toilet which Woodley Town Council has provided. So clearly that signage thing needs to be sorted out in some way. So question is, who is responsible for that then? I mean, I think, borough should be in some way, certainly for the local loo scheme. I'm just wondering whether, as you say, maybe that does go to the town council and or the town council set the management initiative maybe.
Yes, I would agree with that. I mean, I think we can reach out to Woodley Town Council and ask them about the signage specifically for the toilets in their area. We could do that. So I'm making a note of it so I don't forget. On your sorry, Margaret, not there. On your first point around the additional payment, I didn't want to single out one organisation, but I can certainly make you aware outside of the meeting. Thank you.
Okay, Cole? Yeah, okay. Next, I've got Rachel on Teams, please.
Thank you very much. I just had a couple of thoughts and then one question. The one thought is, have we looked at Wokingham Station loos, at getting those added to the local loo scheme? Because they have got toilets in there. The last time I looked, that there was a charge for them. The other public toilet that people don't know about is the one opposite the brown bag underneath the multi-storey car park. So it would be good to look at seeing whether we can get some signposting for that one. And the question I wanted to ask is, I saw at the end of your report, we're looking at getting an equalities impact assessment done. And I wondered what thought had been given to who you would approach to get thoughts for the equality impact assessment. And the groups that came to my mind immediately were women, first of all, then parents of small children, particularly fathers, I think, looking after small children, the elderly, and also has any thought been given to approaching groups such as Support You for their thoughts about the LGBT community. I was talking to at Pride the mother of a trans boy who is on the cusp of sort of primary secondary school, and he would be really wanting to know where there are gender neutral toilets as he can go into, because I think that would be the best provision for him, and I wonder what signposting we've done for that. So just some thoughts about groups that we might want to approach.
Certainly. I think it's an excellent point. My first thought around this is that obviously the council has a new equality strategy that was recently published and agreed last year, and part of that is a lot of work around engaging with residents across the borough from the perspective of their particular sort of protected characteristics, and obviously understanding how those protected characteristics sort of reinforce each other in terms of people's sort of lived experiences in the borough. Certainly through the resident equality, the equalities work, we are setting up a new resident equality forum that's made up initially of 16 organisations representing equality issues across the borough. Quite timely, it has its first meeting next week, a week today. Whilst that group will just take maybe a little bit of time to get up and running, one of the things that we would like that group to do, if it was if it wants to, is to help the council in completing things like equality impact assessments, so that they're things that are done in most cases, or hopefully quite early on in the process around discussions around issues, and can have quite a broad input in terms of people wanting to comment on them. And certainly the new Engage Wokingham platform, which we can use for consultations, which is currently being used for the engagement around the local plan, or local plan 2. That's a good place where if people can get signed up and connected to that, we can get a lot of sort of input into that. So it's, you know, using the sort of technology available to us to be able to get a broad sort of input into those things. I think those would be the things that would be quite interesting to use around this sort of discussion, because it's, you know, as you pointed out there, it's an issue that a lot of people might have, you know, a slightly different perspective with, and certainly one that we want to try and make sure we can support as much as possible.
Okay, that's great. Thanks very much, and thank you for the report. I thought that was really useful in getting an understanding of what we've got in Wokingham and what we might want to do in the future. So thank you very much for that.
You're welcome. Thank you.
Thank you, Rachel. I hope you're okay there, isolating at home.
Yes, I've still got COVID, so I'm going to need to stay at home for a few more days.
Okay, next we're going to go to Michael, and then I think I saw Tahir with his hand up.
Yeah, thank you, Chairman. Just a quick sort of confirmation, Mark, and then a possible question after that. You mentioned North Woodley with the development location there. Is that to do with the change in places toilet, or is that the local loo scheme? What exactly is going to be?
Sorry, it's technology. It's North Wokingham. It's the Matthews Green development. It's where we've got the new community centre that's next to the primary school.
Okay, is that the change in places?
Yes.
Right. Okay. I kind of presume then all the other development locations will have something similar to that going forward.
We want to do it as much as possible. I'm not sure it's going to be possible in every one of the development locations, but we've tried to prioritise it in the North Wokingham one. And yeah, as soon as that community centre opens, that facility is going to be available. I was walking around it fairly recently, and so yes, it'll be good having, you know, another facility that residents can use. Because as you can see from the report, there's, you know, relatively few of them across the borough.
Yeah, I totally agree with that. I mean, it could do with a few more. I mean, I think it does beg the question, which mentioned earlier on, about publicity for these facilities as well, to make it obvious they're there, signage, whatever you want to do. Maybe run it through the local papers as well, and the borough news and websites and the council website and all that sort of stuff as well, which is all pretty obvious stuff, but and whatever ones you can think of, and maybe the local parish websites as well could pick it up, which might be useful. I mean, always very useful using them, and they're certainly good partners.
Definitely.
Thank you. Yeah, cheers.
Thank you.
Thanks, Michael. Tahir.
Yeah, I think you answered like a number of questions I had, really, to be honest with you. But there was something else that just come up really was, does anybody go and look at the quality of these toilets and are they fit for purpose for disabled people, for young mothers, for example?
So we
do pay them a bit of money, even though it's just marginal, and therefore we require a level of service back. So does anybody ever check the quality of them?
Yeah, we do. Periodically, we some of the localities officers have been out and about doing that and checking on the 10 facilities, and it's exactly those things that you talk about, making sure they are clean, making sure that they are, you know, able to be, you know, accessed by the public. We did that the last time, probably just before Christmas, I think, from my memory, a little before Christmas, and, you know, everything was okay with that as far as I'm aware. As this, you know, gets expanded, or this work gets expanded, we'll perhaps want to do some more of that in terms of enhancing that offer in terms of checking. And obviously we're always able to get any feedback from residents who are using them. That's why I use the information around the contact to customer services to make sure that we weren't getting a lot of contact from people who are dissatisfied with those facilities.
And just for kind of feedback, do you get any feedback where, for example, in a busy cafe, a mother walks in with the baby, just uses the toilet and walks straight back out? Do they kind of are they welcomed in, as it were? Or is there any kind of resistance or any description? Does anybody complain of anything like that?
Well, as a council, we don't seem to be getting complaints around it, and I'm not getting any sort of complaints or comments around it. I wouldn't imagine it's something that necessarily would come to me that often anyway. But I think in terms of, certainly our local loo schemes, it's not something, as I say, that we are getting contacted about at the moment.
Okay, thank you very much.
Cool.
Okay, thank you. Any other questions, members? Carl.
Yeah, it's not so much a question, it's just a bit of info really, because I found this out today. If I've known about this for a while, but I found out it was out of order again today. The Waterside Centre toilet has had problems for quite some time with getting blocked, and that's mainly down to kind of in the summer when there's a lot of people there, a lot of people using it. But the main reason is the park runs, which I think are every Saturday morning. I think there's around 400 people go on those on average, and quite a few of them end up using the toilets and they get blocked, and I think they're blocked again. And it's been an ongoing thing for at least a couple of years, I think. So it's just something to kind of be aware of. I know it's going to be brought up at their meeting when I think the BBC rep is Councillor Bath, I think. So it's kind of in his ballpark anyway, I think. So just to be aware of that.
I've been on the board representing the borough in the past, and it has gone on for many years because it's just not simply designed to cope with intense use once a week. Yeah, but a good point to raise. We've got Jim on in the meeting on Teams with us, who'll be speaking to us about Health Watch. And I just wondered if there was anything he'd like to raise, issues that have come through the contributions that our residents give to Health Watch.
I mean, hello, hi. What I will do is I'll bring up in my very brief to you, based upon what the local issues are that we're hearing at the moment. I mean, if you're alluding directly to public toilets, the answer is no, we don't have anything on that.
All right. Okay. Well, sorry I didn't mean to put you on the spot. I just wondered if there was any issues that had come through to you. So, members, we're being asked in the recommendations to consider the information, which I think we have done. And thank you for all your questions. And the recommendation is to review signage and publicity of the local loo scheme and other toilets available within Woking Borough Council facilities. I think perhaps we would like a review of signage and publicity of any toilet provisions, but perhaps if the borough can take that lead in ensuring that when our residents are out and about within our borough, that they can quite easily and simply and without any distress locate the nearest toilet. So if the borough was able to take a lead, facilitating all of the information from the town councils and the parish councils, would you think that would be possible, Mark?
Anything's possible, Chair. I'm sure we could take a look at it. It might be something that we do in stages. So it would involve, our facilities team in terms of things that we're responsible for. Certainly, I'd want to liaise with the communities and communication engagement and marketing team around the more broader sort of access to sort of information about toilet facilities. But it's hand in glove with what we want to do as a local authority, as you've said and other councillors have said this evening, around making sure that residents are aware about where to find and access toilet facilities, and quite importantly, how to give any feedback around the quality of them. So yeah, it's definitely something we could take a look at.
I mean, of course, it's not. Although we're all elected and we're here to represent our residents, we do want Wokingham to be a welcoming place to people coming from beyond the boundaries and coming and spending their money here, using our services, etc. So there is that other aspect of somebody who's never been to a town before, wanting to return because they found it a pleasant experience. But Jackie, I was just going to ask, does the new community centre in Shenfield, which looks splendid from the outside, does that have a changing places toilet, or is it a simply disabled facilities in addition to standard?
I've actually not been in, and I've been into a meeting, but not seen it. I mentioned so. I'll find out.
Okay, thanks.
Chair, I can answer that if you like.
Oh, right. Great, Mark. What's the answer?
The answer is it doesn't have changing places, I think, but it has disabled toilet facilities.
Yeah. I mean, because when you look at that list, I think only 2 of them are within the borough, aren't they?
Exactly. Yes. It's,
yeah. And then it will be 3 with Matthews Green. Okay. Madeline, are you happy with some wording of that? That's great. Okay. Are you happy, members, to vote for the recommendation for a review of signage and publicity of the local loo scheme and all toilets available within our borough? Yeah. Thank you very much. All right, thank you very much, Mark. You're free to go and enjoy the rest of your evening now.
Thank you, Chair. Thank you, everyone.
Thank you all.
Okay, item 46 is an update from Jim Stockley on Health Watch, Woking and Barra. Jim, we completely appreciate that sometimes it's just not possible to get this as an excellent, well, they are very well presented, your usual reports, but we appreciate you coming along and giving us a verbal update.
Yeah, thank you, Chair. I'll keep it brief because I've actually only just got back from the States, where we've been since just after Christmas. So I've had to have a quick catch up with Nick, who obviously comes in with a lot more detail and background. So I'm not been really in touch with anyone for over 3 weeks. And by the way, just just coming back to this issue of where we were talking about toilets. One of the biggest, or one of the common themes across anything for Health Watch is, where do I find out that, whatever it is? And communication in terms of being able to identify, I think as you mentioned, people coming into the town, not just access to toilets, but for how easy it is to access any other services that you might need when you are here. And that is always a theme with us. Where do I go to find out something? Anyway, I'll just touch on a couple of projects, 2 or 3 items of local issue, and probably leave it at that. So you'd be aware that Berkshire Health Trust, which I think we've spoken about this one before, the Ageing Well project. Berkshire Healthcare Trust asked Health Watch Woking, Reading and West Berkshire to conduct like a service user research with the idea that it's an independent one. And it was to research about ageing well services, 2-hour urgent community response and the 2-day community rehabilitation. Now, all I can do here is trail, but actually the project is now complete and it will be shared with the HOSC in time for the next meeting. As with many of these things, it's a question of data analysis and then writing up that report and then agreeing it. But that will be that is done now and will be shared, be available for the next HOSC. Something that I think everyone's aware of, and I know we've spoken about before, obviously the impact of the last 2 years, etc., is GP access. And in fact, we as a local Health Watch have access to about another 9 or 10 Health Watches in a network. And that is telling us that people's experience of access to GP-led care is mixed. And in some cases, inaccessibility is creating significant issues. I think we're all well aware of this, but we're aware of immense pressure primary care is currently experiencing at the moment, and the changed ways of primary care workers have had to work, and the impact that's having upon them as well as patients. So we've been doing a survey. Phase 1 was surveys seeking understanding of the experiences of practice staff. And I know at other meetings, the CCGs have spoken about the impact upon staff. And the second phase is a public survey on experience of GP access. Now, both of these phases we've now completed, And again, much as this is a promise of jam tomorrow, where our team and others are doing data analysis and writing reports on, excuse me, local issues, again, top of the shop, GP access, getting NHS dentist appointments and not being able to register for an NHS dentist. And obviously, I think everyone is aware, but there are more and more challenging issues arising from adult and children's mental health at the moment as well. And that is in a very brief form currently where Healthwatch Woking is at the moment. As I say, Nick will be back in time for the next HOSC, and we will publish our reports to the HOSC in the usual format prior to the next meeting. One other thing I'd like to add is I'm involved in the Arts and Cultural Alliance, and we are looking on that side of the house, and Healthwatch, amongst others, is going to help us, is to develop and identify the benefits of arts and culture to the health and well-being of Wokingham community. So that hopefully will be ongoing work, which we will be able to report to a number of committees and organisations as we go on. Now, I'm only too happy to take any questions, but I may well have to plead ignorance.
Okay, we understand. Thank you.
Okay, thank you.
Members, do you have any questions for Jim? No? I think members would all join me in thanking you very much, and we'll be looking forward to hearing your report, and that'll be at the March meeting, Maddie, won't it? Yeah. And it's very interesting that you're going to be digging into the benefit of arts and culture.
I think this is one area. I mean, just to plead a case, you may be aware I chair More Arts as well, I think it's an increasingly important area for our society and community of the benefits of people being involved in creative activities. So hopefully we'll see some benefit come from that as well.
That's right. I mean, I think we're all keen that the council supports our residents to live healthy and active lifestyles, but we're far more aware that we've also got to be thinking of what will benefit the mental health of our residents. So it's not just providing leisure centres.
No, it's not all sport, good as it is.
So thanks again, Jim.
Thank
pass
you.
on our thanks to Nick and to all the people who are working with you. Thank you.
As ever, you're welcome. Thank you. Bye.
Okay, so members, we're looking at the forward programme on page 35. As you can see, we have got a extraordinary meeting put in for the 21st of February because we've been having to put so much back. Madeline, have the Royal Berkshire Hospital confirmed they will be ready on the 21st of February to come to address the issues, the concerns that we have about maternity services and the winter plan?
Yes, they have.
Well, the winter plan must be nearly over by late February. Is there anything else we could put into that meeting now that we're gaining so many more things and we've got a large list of unscheduled topics? It's just all right. Share it with the committee. It's fine.
Potentially, you could move health integration if officers were available from March to the February meeting.
I think we have to move some things. Yeah, so let's ask if we can move that to February. And then in March, we're looking at the Wellbeing Strategy and Action Plan, the mental health services, where we'll invite our colleagues on children's services, although I believe children's ONS, I believe some of you were on that as well. Ambulance services, we look at that annually, don't we?
I would suggest possibly moving the health and wellbeing strategy item to the first meeting in June to give them a bit more time.
To June? Well, yes, we will have to, I think. Members, has anybody got any comments on the programme? Madeline, when we're looking at the KPIs in March, that will be the fresh ones, not the ones that we weren't able to look at now, won't it? Yeah, okay, that's fine. Right. If nobody's got anything else that they would like to bring forward at the moment, I will close the meeting. Thank you all very, very much. Thank you to Lucianne and thank you to Madeline.
Thanks, everybody.